Hello, my name is Dr. Gunnar Parent. I am a second year family medicine resident at the Chickasaw Nation Family Medicine Residency Program here in Ada, Oklahoma. I am proud to present on my quality improvement project titled Improving the Use of Appropriate Statin Therapy as Secondary Prevention in Patients with Atherosclerotic Vascular Disease, a final update. My faculty advisors include Dr. Adam Vassalero and Dr. James Green. Kind of a background on our project is, as we know, ASCVD remains a leading cause of mortality worldwide, and millions of United States citizens are affected by this disease. Further, there has been substantial literature to show high-risk patients, including those with diabetes and long COVID, are at increased risk of morbidity and mortality with this condition, really emphasizing the importance of this project. Our goal was to initiate ways to increase the rate of appropriate use of moderate to high intensity statins in patients with ASCVD and similar diagnoses. Rationale behind this is we wanted to fall in line with the mission of the Chickasaw Nation Department of Health, which was to enhance the quality of life through health promotion and disease prevention. Our aim was by October 31st of 2025 to achieve and sustain performance above the 90th percentile among patients with clinical atherosclerotic cardiovascular disease. And we chose this date as we were switching from EHRs from our old EHR to our new EHR in November of 2025. As far as our methods, we had both active and passive interventions that we utilized to achieve this goal. As far as active interventions, we used targeted consult style virtual education sessions that were delivered via Zoom to providers and pharmacy staff that really focused on guideline directed therapy and hyperlipidemia management with statins. Furthermore, we did create a quality prescribing quick pick list and statin intensity stratification within our electronic health record to help expedite the process. Passive interventions we utilized was the building of the quality prescribing tool and also collaborations with pharmacy for chart reviews to find eligible patients with ASCVD and reach out to them to either get them on statin therapy or figure out why they weren't on statin therapy. Really, our outcome measures, we had two primary outcomes. They included one, improvement of the delta between baseline and final ABLE ASCVD metrics, and to demonstrate a sustained positive trend in monthly performance data. Our target population included patients that had established ASCVD, that included males aged 21 to 75 and females aged 40 to 75. We used various ICD-10 codes and G codes to find these patients. Additionally, I've included in the bottom here a list of our statin medications that are on our formulary. As we are an IHS facility, we cannot prescribe anything and everything. We have a formulary, so it was important to include that here. And then I also included important exclusion documentation criteria, which included various things such as pregnancy, adverse effects to statins, palliative care, hospice, those type of things. As for our results, we did show that a structured multidisciplinary approach integrating provider engagement, coding support, and evidence-based prescribing pathways can significantly improve statin utilization, documentation accuracy, and quality metric performance. As in all projects, we did run into a few barriers. The main one for healthcare providers was time, just not having the time to do the deep chart reviews that we would like to find these patients. And for pharmacists, it was not so much time, but more or less difficulty within the current RPMS finding the codes needed to find out if they were on appropriate therapy, and if not, why not. Key takeaways from this is that successful interventions can be achieved, but they need to be streamlined, workflow integrated, and minimally burdensome to providers. As far as future plans, we want to continue this trend that we have created, implement it within other clinic strategies here, and take this whole concept and make it more broad to other health conditions and medication utilization. And then to just conclude everything, this was a successful project to be able to achieve and maintain longevity for proper prescribing of moderate to high intensity statins in patients with ASCVD. Thank you for your time. If you do have any questions or concerns, please do not hesitate to reach out to me. Thank you.